So something you may not have known that is tucked into Apple's iOS 11.3 beta is Apple Health Record. And this is enabling users to take their health records with them and to pull in health records from different providers. And they have a number of health systems that have already partnered with them and agreed to start sharing records. And one of the promises of this technology is that people can take control of their own care and no longer just go to the doctor and say, "Doc, something's wrong with me, tell me what to do." But instead, they understand, they have control of their diagnostics, they understand and have the data from different providers, and they can help manage their own health record. We've got Dr. Ted Smith with us again. Dr. Ted, you've had a lot of different hats that you've worn. Now CEO of Revon Systems, previously the Chief Innovation Officer of the City of Louisville. But before that, you had a gig that relates directly to this subject. Tell us about that.
Yeah, this is a great subject, and thank you, Jason. So before working for the mayor as the Chief Innovation Officer for the City of Louisville, I was a Senior Innovation Advisor at the U.S. Department of Health and Human Services in Washington at the Office of the National Coordinator of Health IT. It's a mouthful. But these are the folks that brought electronic health record systems to the country. So the HITECH Act essentially compelled hospitals with a lot of incentive money to dump the paper charts and move to EHRs. And this exciting announcement from Apple, very near and dear to my heart, because personal health records have always been envisioned as a companion to hospital-based electronic health records. And so EHRs and PHRs, it's an interesting dance. Way long ago, it was envisioned for the country that PHRs could, like this Apple technology, could be a very important bridge for those who are traveling through the U.S. healthcare system. That if your hospital isn't connected to all the other hospitals, your phone, in this case, may be the only thing that actually has a reliable record of your health experience, your health history. And so I couldn't be more excited to see this news. I mean, back in 2011, this was just an idea, a concept. It would take a company like Apple to make it a secure, trusted, repository. I'm looking forward to seeing more and more of these health systems incorporating, being willing to connect their EHRs to your phone, because ultimately that will help us realize that vision of the person that is the bridge, to their care.
And part of this is there are some standards around this, right? FHIR, I think, is the name of the standard that these companies have to play with. So it's starting with Apple, and in the U.S. that's great. Of course, we know broadly, outside of the U.S. It becomes a different subject because there's more Android phones. Is there the infrastructure in place to support this? Can something like this actually thrive, or is Apple way ahead of the market here?
Well, I mean, look, if you want to talk about way ahead, there was a time when Google had Google Health, right? Microsoft still has Health Vault. So way ahead, I think, is all relative.
Okay.
I feel like this is starting to scratch the itch of named leading institutions who are like Johns Hopkins and others who have signed up, put their name on the line, their brand on the line, and said, we work with this, right? So I think we're maybe midway through the sort of ultimate evolution. You're absolutely right about Android and the market share. We can't necessarily rest on a single vendor platform, but at the same time, what's going to move it is adoption. And really, if you look at, as you know better than I do, the smartphone industry, created by Apple, right? And now made better or made different by everybody else, right? And so I think we can look forward to that in healthcare. That, thank you, Apple, for sort of forcing this. Now I hope there will be a whole lot of fast followers who seek to improve it, and that consumers, patients, say, gosh, it's not the big a hassle it used to be. Like, still today, you go in the doctor's office and you fill out the same fields they already know, right? And you fill it out everywhere you go. I mean, that's really irritating in 2018. Awful. And the opportunities for mistakes being made and transcription. I mean, we really do deserve a better healthcare system. These are steps that get us there.
All right, if you are interested in digital health, subscribe to TechRepublic's Next Big Thing newsletter for all the latest in digital health and innovation. Thanks for watching. We'll see you next time.